Hi, welcome to Aurora Sinai Medical Center, your home for the next 3 years. My name is Amit Gir.
My name is Molla Teshome.
And I'm Jennifer Carvin. We're all second-year residents of Aurora Healthcare at Aurora Sinai Medical Center, and we're about to take you a tour, so let's get started.
So now we're standing to the entrance to the emergency room where all the patients you'll ever see come through. So let's go take a look.
Here we are in the emergency room in the doc box where we check patients first in. We talk to the emergency physicians and go into the patient's room and see the patient for the first time. The hospital is located in the center of the city and we get to see amazing variety of patients.
This is a typical emergency room where most of the patients are brought to. It has full capabilities for telemetry to monitor the patient's vitals, has computer access to access their chart, while at the same time the ER is right behind you, so if you need any other assistance in the event of emergency, you're never left alone. So this is our 24-bed medical ICU, where patients are brought in their critical states and taken care of by a number of staff and nurses and residents. And here we have a resident team right now.
So now we're inside one of the typical rooms here in the ICU where we take care of most of the sickest patients. So as you could see, we have complete monitors here. A typical team is composed of 1 senior resident and 2 interns. And we also have our ICU attending, the intensivist. So they rotate here for 1 month at a time. And during the night, a senior resident goes on call. On call, we usually have an intensivist, a phone call away or a page away, but what's special about our ICU is we have the eICU system, and Mola is here to talk more about it.
So as Jennifer said, we have this eICU. It's an off-site 24/7 continued support in here. There is an intensivist in an off-site campus who always monitors the patient. The intensivist usually looks into the patient and then gives you immediate assistance until the intensivist arrives or so.
This is a typical medical team composed of medical students, interns, senior residents, and the attending physician. Here they go room to room and engage in bedside learning for important clinical points. This is the 4th floor of one of the main medical floors. Here you'll see hospital beds flanking both sides of the hall. And the teams in the morning round these halls and go through the patients for bedside rounds, which is important for education because you have to see what you're learning and you get inside information from your attending about what's going on. Let's keep going down the hall. And here we have the nurses station where everyone meets to talk about patient care from attendings, nurses, case managers, social workers, and other fellow residents and interns.
Welcome to the Residence Lounge. As you can see, we have computers here available so we could access our patients' electronic medical records. This is basically the area where we stay when we're on call overnight. In this area, we have several features. We have a kitchenette, which has a refrigerator, a microwave, and a coffee maker. And it is also in this area where we have our individual private call rooms.
Here we are in one of the typical call rooms. Whenever we are on call, whenever you get some time to rest, you can come in here. You'll have a private room in here with a attached bathroom and comfortable bed. You can also watch TV. There is a Wi-Fi all over the hospital. You can surf in the internet. And also there is a telephone if you get call from the nursing staff regarding patient care.
It's not all work here. We do have some downtime. So now let's head over to the Outpatient Clinic Center where you'll be involved in continuity care clinics your entire 3 years here.
We're now here at the lobby of the Internal Medicine Clinic, so come along and I'll take you a tour inside. So we're now here in the outpatient conference room. This is the area where we get to discuss our cases with our attendings, and it is also where we get to access the electronic medical records of our patient. This is also the area where we get to dictate our clinical notes during the clinic hours. Here's one of the clinic rooms where we do our patient encounters at.
This is Aurora Sinai's medical library where you can have access to over 15,000 journals to help you with your own personal research projects or other projects going on in the hospital.
This is the conference room. This is the area where we have our morning reports, business meeting, and noon conferences. The conference room is also the area where we have special reports given in by different guest speakers from various subspecialties to teach about different pathophysiologic processes.
Thank you for coming along on this tour of Aurora Sinai Medical Center. We hope you apply and we hope to see you next year. So here we are at St. Luke's Hospital, one of the more larger hospitals here in the Milwaukee, Wisconsin area. My name is Amit Geer.
And I'm Olga Norman.
And we'd love to show you around, so come along. Here we are at the Healing Garden, one of the more unique aspects of this hospital. This Healing Garden exemplifies Aurora's commitment to the healing process and to living well.
This is the cardiology ICU, one of the 4 intensive care units in the St. Luke's Hospital, with its nice and big rooms that allow us enough space for procedures that can be done at the bedside.
Cardiology is one of many of the programs and residencies available here within the Aurora system. Cardiology itself has 6 spots. We also have gastroenterology and geriatrics. So now we're in the resident lounge, a great place to rest and relax, watch TV, grab a drink, or even grab a nap. We also have here the noon conferences where you can have daily teachings from disciplines from all over the hospital. The call rooms here are well equipped with computers, your own private room, and bathrooms. Here we are at the deli, one of St. Luke's many culinary options. This deli is known for its lunchtime soups and its sandwiches.
And it is in addition to our full-service cafeteria that includes a grill and a sandwich station. This is the St. Luke's emergency room with its over 40 beds, and this is where you will see the majority of your admissions.
So thanks for coming along on a tour with us here at the Internal Medicine program at Aurora Healthcare.
We really hope to see you here next year.